right, good morning, afternoon, evening, nighttime, middle of the night, crack of dawn, people. Today we are going over the better breathing techniques. I want to talk about what they are, what they're not, okay, and teach you how to do them. Today I'm going to teach you the better breathing techniques, also known as the controlled breathing technique. Even though I'm going to teach them as three separate entities, they're really meant to be used in combination as something that we'll refer simply to as the breathing. So the three techniques that I'm going to talk about are going to be diaphragmatic breathing, pursed lip breathing, and paced breathing. The other thing to consider is that there's something called recovery from shortness of breath, and these involve certain positions and breathing patterns that will help you recover when you're in that code red situation. Let's start with diaphragmatic breathing. The first and most important thing to realize is that unless you have a paralyzed diaphragm, all breathing is diaphragmatic breathing. So when people say things like, no, you're not using your diaphragm, or you have to do the diaphragmatic breathing, it's a bit off because it doesn't matter if you breathe in through your nose, breathe in through your mouth, etc., etc., etc. All breathing is diaphragmatic breathing. The diaphragm is a big dome-shaped muscle that sits above the abdominal contents and below the lungs. The diaphragm contracts downward in response to stimulus from the phrenic nerve. Now, the phrenic nerve is stimulated, or is innervated, I should say, by cervical vertebrae 3, 4, and 5. The reason I point that out is because if you're somebody who's got a lot of neck problems, particularly things like severe osteoarthritis, degenerative disc disease, or spinal stenosis, there is a slight possibility that this can be affecting innervation to the diaphragm. The diaphragm is innervated by the phrenic nerve, and the phrenic nerve is innervated or receives its supply from cervical vertebrae 3, 4, and 5. So if you have neck problems, this is something that could potentially affect your breathing. When the diaphragm contracts downward, that creates a negative pressure in the abdominal and thoracic cavities, and this is what causes the lungs to inflate, filling with air. Now, when people have obstructive disease, things like asthma, emphysema, chronic bronchitis, COPD, they have difficulty with the exhalation phase and as a result can potentially wind up with hyperinflated lungs. Now, this doesn't happen every time. It's not a given. But if you do have hyperinflated lungs, those lungs can press down on the diaphragm, flattening it out and decreasing its mechanical advantage, making you more short of breath. Now, very often, clinicians will try to teach patients how to do diaphragmatic breathing, and I'm not saying that that should not be done, okay? It absolutely should be done, but I don't want people to have the idea that if they sit around doing diaphragmatic breathing for 15, 20, 30 minutes a day, or even 30 hours per day, that that is going to make them less short of breath when they're walking up a hill or climbing stairs, because it's not. I talk over and over again about the fact that breathing is multifactorial, meaning that there are many, many, many factors that go into how well or how poorly we breathe, other than just the respiratory system alone. Typically, when people start to get short of breath, it happens at high levels of activity or periods of increased demand for air. The breathing techniques will help you to increase the supply of air during these activities so that you can do more of these activities, or so that you can do these activities with less distress. That is what will ultimately make you less short of breath. The next breathing technique that we'll talk about is pursed lip breathing, okay? When you're doing your diaphragmatic breathing, you're going to be breathing in through your nose. You're going to breathe in for a count of 2 to start, and you're going to blow out for a count of 4. So again, using the example of breathing in for a count of 2 and out for a count of 4, it will look like this. So the goal is going to be to breathe in for a count of 2 with a slight pause before blowing out through pursed lips gently through a count of 4. So the goal is going to be to breathe in through your nose for a count of 2, followed by a slight pause before blowing air out gently through pursed lips for a count of 4. Now, very often I will hear people give the instruction, breathe in through your nose like you're smelling the flowers. Fine, no problem. Then I hear them say, blow out as if you're blowing out the candle. So what that looks like to me is this. Right? But the problem with that, and the reason why that is not the correct instruction, and the reason why blowing out the candles should not be your goal, is because the forced exhalation maneuver actually increases airway obstruction. So if you think about when you get a pulmonary function test, what do they ask you to do? They ask you to breathe in and blow it out slowly, and then they ask you to breathe in and blow it out as hard and as forcefully as you can, sort of like blowing out the candles. Now, the reason why they do it on a pulmonary function test is because that maneuver will actually elicit the obstructive response. That will be positive for an obstruction. That's the exact opposite of what we want when we're being active. So the instruction that I will give you is to breathe in through your nose. Breathe in through your nose for a count of 2. If you want to say smelling the roses, if you want to say smelling the flowers, all good. Breathe in through your nose for a count of 2. Blow out gently as if you're trying to cool soup on a spoon without blowing that soup across the room. So that's going to look like this. Now, when you start practicing this, okay, start off by reclining gently in a chair. Take a nice deep breath in for a count of 2 through your nose and blow it out gently for a count of 4 through pursed lips. Now, here's some key points. When you're breathing in through your nose, try to keep your neck muscles, your shoulder muscles, your chest muscles, and your back muscles as still and as quiet as possible. When you're breathing in through your nose, our goal is to keep the muscles of the neck, the shoulders, the back, and the chest as quiet as possible. So nice deep breath in through your nose. And as you let it out, there's that little pause, and then out gently through pursed lips. Deep breath in through your nose and out through your mouth. Breathing in, and blow 2, 3, 4. Breathe in, and blow 2, 3, 4. Now, try to practice this with the goal of keeping the muscles of your neck, shoulders, back, and chest as quiet as possible, breathing in through your nose for a count of 2 as your abdomen rises as you take that breath in, followed by a slight pause, followed by the nice, gentle, easy exhalation through pursed lips for a count of 4. Another thing to consider is that rather than thinking of blowing the air out, think instead about just creating a space and letting that air come out naturally. Okay? Normally, inhalation is an active process, which means that it requires muscle contraction in order for you to take the breath. That muscle is the diaphragm. Under normal circumstances, the lungs will deflate or exhalation will occur passively. Except that when people have difficulty blowing air out, they actually work harder to breathe. And the harder you work to breathe, the more airway narrowing we get, the more air trapping we get, and the harder it becomes to breathe. So when you're in that situation, or when you feel like you're getting to what I call the code red, before you get to that point, tell yourself you know what to do here. Tell yourself to stop. I know what to do. Start working on diaphragmatic breathing, which is breathing in through your nose while keeping the neck, chest, and back and shoulders quiet. Blow out gently through pursed lips, and when you're combining it with an in for 2, out for 4, and this sort of paced cycle, this controlled pacing cycle, that is what we refer to as paced breathing. So just to review, diaphragmatic breathing: sit comfortably in a chair. Take a nice easy breath in through your nose and out gently for a count of 4. So take a nice easy breath in through your nose for a count of 2 and blow it out gently through your mouth for a count of 4. Nice deep breath in through your nose and out gently through your mouth. So those are the basics, okay? Diaphragmatic breathing, pursed lip breathing, combining them together into what we call paced breathing. Now, the question often arises as to whether I should breathe in through my nose or out through my mouth. Or what if I can't breathe in through my nose? And it could be because my nose is stuffed. It could be because I have a deviated septum. And the answer is, it really doesn't matter, okay? When you breathe in through your nose, 3 important functions take place. Number 1, the air is filtered by the tiny hairs called cilia in your nose. And number 2 and 3, the air is warmed and humidified by the capillaries. But if you breathe in through your mouth, you can still do diaphragmatic breathing because, as I told you before, all breathing is diaphragmatic. And if that's the case, then you can breathe in for a count of 2 through your mouth and blow out for that same count of 4 through pursed lips, and that looks like this. So that's it. So we got diaphragmatic breathing, we have pursed lip breathing, we have paced breathing. When we talk during our 90-minute seminar on Wednesday, I'll review these techniques with you again, and I'll also teach you about recovery from shortness of breath. But for now, I want you to practice the breathing. Have a great day, everybody.